GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everyone, and a pleasure to be here again. I'm your host, Dr. Vanessa Appiah, and welcome and once again to CATHIP's Health Hour. So today, I just want to welcome all our regular listeners who make time in their schedule every week to be here with us. I always say we don't take your time lightly, so thank you for being here once again, and welcome to all the new listeners today. And today, as ever, we have a jam-packed morning in which you're going to be hearing some of the work that we've been doing to evaluate what we do in the Health Hour, and then you're going to be hearing from another wonderful doctor who's going to be talking about the power of our mindsets. So really asking you to just enjoy the morning, but also participate as well. And I always want to take a moment just to highlight who CATHIP is. And so CATHIP is the Caribbean and African Targeted Health Improvement Program. And essentially, it's a collaborative and educative space where it's a real health literacy program in which we are coming together to ensure that we are meeting the health needs and health education needs of our communities. And it's powered by Black people and delivered by Black people for our Black communities. So we're so honored to have you here. But because it is for you, we really want to make sure that you engage. Please put your questions in the chat. Let us know where you are, who you're listening with. And also there'll be an opportunity at the end for you to also ask questions, and you can ask questions directly as well. And when we think about CATHIP, it's a partnership and it includes many organizations that have come together for this initiative. And we have the Caribbean and African Health Network, we have the Black Health Initiative, we've got the Royal Assembly and Redeemed Christian Church of God, we've got RAFA International Development Agency, we have Croydon BME Forum, and we have the Enfield Caribbean Association. So as ever, great organizations that have come together for you. For those of you that are normally here, we normally do the announcements at the end, but we often find that things can be a bit rushed and you don't often get the opportunity to listen through all the announcements. So we're just going to switch things up a bit, and I'm just going to hand over to my colleague Natasha, who's just going to let you know what's coming up in the upcoming week following today's health hour. So I'm just going to hand over to Natasha, and then we've got more for you this morning. So over to you, Natasha.
Thank you. Apologies. Thank you. Let me just share my screen with you all. No matter how many times you do this, it's always perfect. Hope you can all see my screen. So every single Saturday, as Dr. Vanessa said, we have a commitment with Black health, with health literacy, and just improving the outcomes for health for our Black communities. So Health Hour is here every single Saturday, even last Saturday, as many of you probably participated. We had a gala, and still we always have Health Hours. So next Saturday, we'll be here at 11 a.m. Faithfully to you all. And we have as well Healthy Hearts. So basically is a session focused on nutrition, on diet, on physical exercise. So all the good medicines that keep you healthy. So next week, we're going to be talking about would you like to learn how to manage blood sugar without medication. So this is with our host, Dr. Hiba, and guest speaker is Nana Okran, and our physical instructor, Orlando Grant. So it's going to be a great session. Everyone that is interested about health improving, there's a lot of space to make questions and to have discussions about nutrition. So do come and join us and learn more about how to manage your blood sugar. We know that diabetes type 2 can be prevalent in our communities. So it's a great opportunity to understand more about sugar and how to manage it. So on this topic, we are running a campaign to really raise awareness on diabetes type 2. Individuals of Black ethnicity are more at risk of type 2 diabetes. We'd like you to understand more about it. I'll drop the link on the chat, but there is also a QR code on the screen where you can understand more about the condition. If anyone is interested about doing an online risk factor assessment as well, do message on the chat and I'll send you the link for that as well. And blood donation is quite important as well. Our question is, are you the giving time? We invite you to be a blood donor. You know, donating blood it is really almost an easy way to be a hero to others. We know that, for example, sickle cell condition is particular to our communities, and it does ethnically matched blood does matter. So it's important that if you are able to donate blood, that you register on the link on the screen, which I will also share on the chat, and start donating blood to the ones in need. If you have a thought of changing your career, or if you wish to, get into a career into nursing, Leeds Trinity University, not too far from Manchester, where Khan is based, but now we are national. Obviously, I know there is people joining us from all over the country and other countries as well. But if you are from this area, Leeds Trinity University is still open for their nursing degrees. So do join us, do join them, check their opportunities. UCAS points are not the only way to join university. Your life experience, your work experience matters. There are opportunities out there. So if it's in the back of your mind, I'll leave the details on the chat as well later on for this. And that's really the announcements for today. As you know, CATIP is made of a few partners. Besides SCAN, the contacts on the screen, we also have Enfield Caribbean Association, which we are very proud to have join us. We have RAF International Development Agency, the Royal Assembly Redeemed Christian Church of God in Sheffield, Croydon BME, and BHI Black Health Initiative. So without our partners, CATIP would not exist. So thank you so much for being part of this collective effort. That's it from today's announcements.
Thank you so much, Natasha. And one of the things that many of you have fed back to us is that really what's going to happen with CAFIP, how are we doing, how can we, are there things that could be done better? And so as part of this work, we have commissioned the wonderful Dr. Matthew to lead on an evaluation of CAFIP and the Health Hour. And so we're really honoured. Before we have Dr. Amobi come on and talk about our mindset, Dr. Matthew is just going to talk about the evaluation that he's carrying out and just exploring how some of you on the line may be able to support us. So I'm just going to hand over to Dr. Matthew. Thank you so much.
Thank you very much. As I've been introduced, my name is Dr. Matthew Nyashanu, and I'm a senior lecturer at Nottingham Trent University. I'm leading on the evaluation of CAFIP work. We have had some wonderful interviews, some feedback, and also some recommendations that the community would like from CAFIP, and to extend this work nationally. And it was very interesting to note that the work had impact from narratives of people. I must say we are still open. We are still open to take more narratives about how CAFIP has impacted on communities' life, and would like some feedback from members of the community. And also, I think we would also use some of these activities that CAFIP is doing to try and show the impact. So probably we'll soon be trying to get some also quantitative data in form of workshops, in form of also such things as the health hour, and try to also add it to the narratives that people are giving us. If you have anything to share, probably you could actually throw some of the things in the chat, and I will take them and also add them on the part of our evaluation. And I will also leave my email for those that may want to give me some testimonies that will add to the lived experiences of people that have actually been impacted upon by CAFIP. Please feel free to do so. Thank you very much.
Thank you so much, Dr. Matthew. And I can't emphasize enough the importance of hearing your feedback, and so that we can feed that into our evaluation, but also as ever, as we want to continue and we want to expand, we want to make sure that we are delivering the service that you need. And sometimes it's great to get pockets of feedback, but if we can get some large volumes of feedback, it just really gives us the assurance that we are providing what you need, and also giving us ideas for the future as well. Because as individuals, as communities, as networks, our needs do change from day to day, from year to year. And so if there are other things that you would like to focus on, or other things that you think that we don't do so well and you would like us to improve on, we are not shy of criticism at all. Critique allows us to improve. So please, 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 feedback to us, whether it's in the chat or, as Dr. Matthew said, he'll be leaving his email, and then you'll have the opportunity to feedback directly. But we're really looking forward to hearing more from you. We've had some really insightful feedback to date, and we're really looking forward to receiving more. So thank you all so much. So for the rest of this morning, we are really excited as ever, because we have Dr. Amobi here, who will be talking to us about our mindset, and really thinking about, can our mindsets really determine our physical and mental health and well-being? And I'm just as we are Dr. Amobi will be loading slides, etc. It will be really great to just hear from you. Do you think that the mindset determines our physical and mental well-being? What do you how does it impact yours as well? Because I know for myself, whether in any situation, if I do have a positive mindset, it really gives me an opportunity to be quite determined about my physical activity, whether I go to the gym or not, also, and my mental well-being, particularly in juggling life and work and other responsibilities. And so it really we're really excited that Dr. Amobi will be here to really share their thoughts on this, and also guide us on to how to, if we are having difficulty in balancing our mindsets, what can we do to make sure that we shift it into a positive space? So whilst Dr. Amobi will be loading slides, it will be great to get some feedback from you in terms of how we're doing, and also just your reflections about the mindset, because as ever, what I really enjoy about these sessions is hearing from you and your experiences and your reflections. So whilst we're just doing the slides, I'll just ask you to just feed back to us. It will be great. And also let us know where you are too, because it's always great to know where you're listening from and who you're listening with. So I'm asking you to do a bit of work while Dr. Amobi loads things, but that will be great. Oh, thank you. Oh, Husna from Croydon, your first time. Welcome, welcome, and thank you so much for joining. A real pleasure. And thank you for supporting us and feeding back in the chat. Oh wow, we have someone from Lagos. You're very, very welcome. Selena from Birmingham, you're welcome too. Thank you so much. Do bear with us as we're just getting the slides on. Oh, Siobhan from Switzerland. Oh, this is very impressive. I love it. I love it. We've got someone from Manchester as well. You're all very welcome. I'm getting private messages from someone in the Congo. What's this other one? They're still typing. Oh, someone from Paris. Oh my goodness. We are very honored. And I have to say that I'm hosting you guys from Ghana as well. So we are truly international and fully national across the UK. We've got Manchester, Birmingham, we've got Enfield and Malika as well. Welcome for your first time. So I'm loving the engagement. Thank you all so much. This means a lot while we're just trying to get the slides on in the background. Please stay with us. It'll all be connecting soon, but it's great even to have the opportunity to connect with you all like this. I love, Titus, your reflection there, that the mind is connected to the body, and like the placebo effect, positive mindset promotes good health. Exactly so. You've articulated it so well. And as we do hear from Dr. Amobi, I'm sure that they'll be reinforcing that. But I'm also, as I said, looking forward to just thinking about how we align our mindsets, particularly in these troubled times as well. Great, Faye and husband from Bristol, and a regular. So I have to give a huge thank you as well for being here week in, week out. As I say, it means a lot to us. We've got Bishop Dr. Joe Eldred from Walsall, fantastic. I don't know if I've mentioned, we've got Ngozi from Southend. So really appreciated. Sheffield, you're keeping it going while we're just trying to get things sorted in the background. Thank you so much. I've also just got a private message from someone in Italy. You're very, very welcome. First time too. I'm loving all the international presence, and I'm just wondering how you found out about us. So this is absolutely fantastic. Please keep it coming, and please bear with us whilst the slides are going on. Oh, thank you. Yes, a real honor to host from Ghana. Yes, I could never miss a Khan session, CAFIP health hour session. So no, great. Oh, thank you, Husna. So you got the link from a fitness group friend. Oh, so that's great. Word of mouth is so powerful. So thank you again for coming on. And if you will all bear with us, I'm just clarifying from colleagues just what's happening with the slides. I don't want to lose you. You've taken your time, and I promise it will be a fantastic session. So we just need to give it a few less than a few minutes. I think it's coming on. Whilst we are waiting, okay, thank you, Natasha. Natasha's just put in about prompting you for suggestions to improve the health hour. So please keep those coming whilst we're working in the background. Just to say as ever, these sessions rely on the fantastic support from clinicians, doctors from all different fields and walks of life to just be really here so that we can give you, first of all, the representation of Black healthcare professionals, but also just really leveraging their knowledge so that they can convey it to you in the right way. And Dr. Amobi, we've realized it's actually not actually with the slides that CSU, he's just actually rounding up with a patient. So all the doctors are volunteers. They're here in their own time just to educate and support. And so sometimes things aren't as smooth because they are still working in their other life. So we're really, really grateful that Dr. Amobi is even fitting us in today. And I know that as soon as he finishes with his patient, he'll be here. So thank you so much for staying with us and just persevering. And please keep your comments and reflections coming in. And we do know that for we recognize that some people have just direct messaging me just to tell me that they may have slipped off to make a coffee, or one person is doing some cleaning whilst we're waiting, which is great. And they're keeping tuned in though whilst they're doing the cleaning, so we really appreciate that. And Dr. Amobi is just coming on now, so we're eagerly awaiting. So, but thank you also all. Oh, thank you. And Verna's written that it's her first time listening in and her sister told her about it and she's really looking forward to it. So thank you. Really, really grateful to have you here. And I can really say that you won't be disappointed by Dr. Amobi. So we're really looking forward to it. Great. Oh, I'm loving this. We have regular listeners feeding in and first time listeners. So we've got Sandra from Wickford who doesn't miss it and has the alarm every Saturday. So I love it. And then we've got, I think it's Lynn. Yes, it is Lynn from the first time listener from Church of God of Prophecy. So thank you. It's fantastic to have you here. And Dr. Amobi, I think that you are on the call. Am I right?
Yes, you are.
Oh, wonderful. Oh, thank you so much.
No worries.
No, I know that you've been busy this morning, so I think and everyone has bared with me as I've been filling in time.
Thank you. No worries. So
perfect. So over to you.
Yeah, I'm going to share my screen, and then then we start. Yeah, bear with me a second.
Great. Whilst we're doing that, we'll just colleagues will just spotlight you and just see if your slides are coming on.
So interesting to see that so many people are joining us from so many
Well,
parts in the world.
Well, exactly, Natasha. I've just had another direct message that I've from someone else from Nigeria as well who's joining. So I'm loving it, and thank you for engaging whilst we were waiting for the slides. So really appreciated everyone. That's
Like
why
said,
I love doing calm.
Yeah. So definitely was a good opportunity to know where people are joining from. Sometimes we don't know, so I really enjoyed that from our side. It's quite interesting. Okay, that's perfect.
All right.
Oh, thank you, Mother. Appreciate it. Great. So, Dr. Amobi, over to you.
Thank you so much. And thank you guys for holding the fort. I had a clinic this morning, and I'm still in clinic anyway. I opened a brand new online GP clinic, which is doing really well. We just only started a couple of weeks ago, so I had to get someone to cover for me while I do this, because this is part of my give back, my own opportunity to talk to people in our community, I'd say. So so thank you everyone for your patience. I really appreciate it. I think I've given a speech here a number of times, and it's always been really well received. I see quite a lot of people here, recognize so many names, few that have contacted me privately in the past. So it's always good to be in a place where you know some people. So now, so in terms of today, when I was asked to give this talk, I was thinking, what topic should I actually bring along? Because we've done about 26 odd different topics over the year, and I wanted to try something different, something that I tend to do on a day-to-day basis, which is not only my job is treating diseases, my other job as well is preventing it. And the other job is to make sure that if you got it, I'll be able to help you to reverse it, because that's how it's supposed to be. Now, so I wonder how many people here knew, if you can actually put one on the chat, if you know that this month is Men's Health Awareness month, actually. Does anybody know that already? I want to see some movement in the chat. Last time I was here, you guys were super quiet. And I know it was because we were talking about something dodgy. That's why everybody was a bit quiet last time, but today is going to be a bit more different. It's going to be more free, and I'm sure you're going to get something. Okay, brilliant. Wow, you guys know quite a lot, way better than people that I saw in clinical practice. Last month, on just only one day was Menopause Day. And I asked all the women who come to my clinic if they knew that October was menopause month, even though they only have one day of that. And almost every single one of them knew that. And since October, I've been asking almost every man that I meet if they knew that November is Men's Health Awareness Month, and they didn't have idea. They didn't have no clue. So it goes to show you the importance of us talking about hair-related issue, particularly in our community, right? I started a podcast recently, which I'm aiming towards people from the Black community and Africa as well, because it's a global village now. Now, in the past, when I give talks, it's usually people in the UK and the US, but these days I will get somebody as far as, Ilorin in Nigeria, as far as Mumbai, as far as in Kenya. So so it's a global village, and I want to make sure that whatever skill set that we have, as clinicians, or whatever skill that you have, you actually share it across the world so that people will be able to learn even a thing or two. That will be a win. So we got an episode that's coming up tomorrow that is specifically looking at how men would typically present in clinical practice if they have things like erectile dysfunction, which is what we talked about last time. And it is exactly one of the inspiration from that topic we did last time that made me want to talk about our next how to actually apply change in your day-to-day life. So now, so this is a quote that I actually came up with this quote. I said some of the diseases that kill Black people can be reversed. And one of the primary reasons why I come up with this slogan is that we rank #1 in almost every diseases that you can think of. We are #1 in high blood pressure, diabetes, prostate cancer, Alzheimer's, just name it. And it doesn't have to be like that. So when I'm going to tell you a story. So my health coaching actually started when I met a Nigerian man. He's a high network individual. And so he usually comes from from Nigeria to the UK every single year to do his health check. And his aim is to make sure when he gets scans that that it doesn't show that he has cancer or any disease that can kill him. So he's been here up and down for 5 years, and I met him through someone, and I looked at all the big glossier of high quality, high printed out results that he gets every year. And while all the tests shows that there's no evidence of cancer, but all these small things that could potentially kill him have been gradually going up, and he's been ignoring it. And he started off with a small sugar, now he's knocking at the door of diabetes. He didn't have high blood pressure, 5-6 years later, now his blood pressure is climbing. But his priority, though, was that provided that he doesn't have anything like cancer that can kill him, that's what matters. So the aim of this talk today is to encourage you on how to make changes in your life that are going to be very useful, so that if you apply them, it's going to be hard though. But if you follow some of the advice that we're going to talk about here today, I'm sure you're going to be fine. Because, that's what we're all about. It's all about giving something the best shot, and then watch the result happen, right? So I put up this thing here, say who dares win. I wonder how many people here are football enthusiasts like I am. I support Arsenal though. But this, I saw it when I gave a talk in Tottenham Station. It's a national conference where I gave a talk about health issues that are affecting Black people. And I looked up at the brochure they gave us, and it says, who dares win? I was like, this is phenomenal. And this is the motto of Tottenham Hotspur Football Club, who dares win? And I'm going to explore what exactly this means to me when I was reading, and I was like, wow, this is extraordinary. This is amazing. Because in my mind, it's all about, if you work hard towards something, you will win. But the hard work is going to be painful. But you have to be committed to do it. So my hope today is that you'll be able to learn ways how you can close the gap between where you are today in your health. And this is also transferable, so you can apply this in your normal day-to-day life. You close the gap between where you are today and where you want to be tomorrow, right? So, and we're going to go through some examples on how to make the invincible visible. You know, when I started working in Tottenham, which is one of the heavily populated Black community, and I've worked in almost every borough that have the highest population of Black people, but Tottenham was one of the first places that made me very passionate about Black people's health. You know, when I first got there on the day I first got to the surgery, I was only there just to cover one shift. Just one day, I'm done. And I walked through the door. One of the patients, I was just sitting in my room getting ready. And this woman walked past me and she goes, "Is that a doctor?" And they go, "Yeah." And she walks straight back into my office and knocked at the door. She goes, "Why go on, bro? So you were a doctor. It's good to see a Black man will be doctor." You know, all this, like, you know, I love how Jamaicans talk. It's beautiful. And what emerged was, then she says to me, "Are you going to be a regular doctor here? Because so many of our men need help. You know, you men don't go to hospitals. Men don't go to doctors. So if you're going to be sticking around here, I'm going to go outside and talk to a lot of people to say, hey, we got a Black doctor here." And then, of course, I was just there for just one day. So I said, no. She goes, "So you are one of those drive-by doctors, right?" So I said to her, "Hey, you know, you see a good-looking brother here with a tie and a suit, and you're talking about drive-by." She goes, "No, that's what I call the locum doctors. Those people who come in the morning, and when you call back in the afternoon, they don't work there any longer." So I didn't really take any notice of her. I just smiled and said hello, and then that was it. Then my clinic started. From first patient to the 10th patient to my whole morning patient that I saw up to 30 people. Almost every single Black person who walked through that door had high blood pressure. Half of those who had high blood pressure got diabetes. A significant proportion of people who walk through that room know someone who has had stroke, someone who has Alzheimer's disease. It was extraordinary. It was the first time in my career that I've actually went and spoke to a manager to say, hey, do you mind if I stick around here a little bit longer? Because the aim was for me to be there just one day. And I stayed there for a few years because I saw that a lot of people in our community need a lot of help. And perhaps as somebody who understands, you know, some of the cultural nuances, it would be a good way to reflect and speak to our people and educate them about their health issues, right? I put this quote here. It says, "Seek ye first the kingdom of God and his righteousness, and everything shall be added unto you." And I'm not a preacher, I'm not a pastor, but this is my dad's favorite quote. I remember when I was first year medical doctor, that was many, many years ago. And one of the things we used to do back then is to do a lot of shifts. So you start a night shift at 8 p.m. and you finish like about 11 a.m. the following day. Day 2 into the job, I called my dad. I was like, I don't think I'm going to hack this because this night shift is extraordinary. I've never done night shift prior to that or anything that long. And he says to me, he sent me a message. He said to me, "Seek ye first the kingdom of God and righteousness." So I called him back. I was like, what exactly has like seeking righteousness got to do with, you know, my night shift? And then he says to me, there are 2 ways for you to survive in this job. Number 1 is that someday you're going to get to the position where you don't have to do all of these shifts. This is a rite of passage. But one of the things that will give you more strength, though, is if you have to look at it as though that you're helping God's children and then asking for power, energy, and strength, that you're going to move through it. And so that anybody that you speak with is going to learn something and it's going to change your lives. So the aim of this parable here is basically that it's almost consistent with who dares win. For you to get to anywhere that you want to get to in life, you're going to have to be committed to work hard, but it's not going to be easy. It has never been easy, ever, right? And this is why I said here, have an aim. If you don't have an aim about anything, particularly about health-related issues, you are going to struggle, right? It's all about, one of the great things about the body, this is what I say to people in clinical practice. I always say to them, anytime your body gives you a warning, pay attention to it. Because whenever you get a little bit of chest pain, your heart is trying to tell you something. Anytime you get bellyache, your heart is trying to tell you something. You get a headache, your body is trying to tell you something. Your body always communicates to you all the time. Now, it's important now for you to go, okay, cool, make a decision. If you let this warning keep going up, this red flag flashing on your screen all the time, what are the long-term implications of it? And I'm going to give you an example of why I'm saying this. Is when I was working in a predominantly Black community, there was a lady, she's about 55 years old. She's an African lady. She had high blood pressure. For years, she never showed up to any clinic, any reviews. Every time it's DNA. But a very nice, lovely lady. Got little kids at school. Got her elderly parents in Africa that she's supporting. Just bought her new house, everything. And then one day, she wanted to go to work. She bent down to pick her bag up. She couldn't lift it. And she wanted to scream for somebody to help her. And the voice was slurred. The weakness is slurred. She put two and two together. And she had a stroke, right? Now, one of the commonest reasons people have stroke in this country, every 3 minutes, 3 to 5 minutes, one person will have a stroke in the United Kingdom. And she was one of that statistic. If you walk all the way backwards and see her clinical report, her clinic letter, she doesn't have a blood test, she doesn't come for reviews, she doesn't do anything at all. But she was working. She had a family. She had so many people supporting back home. She's sending money every time. Everything is work. She went from being an able-bodied person to somebody who needed about 13 professionals, from neurologists to physiotherapists to occupational therapists to nurses, everybody. It took about 13 experts to get her to learn how to walk up the stairs. It took all of these people for her to learn how to talk again, to learn how to swallow. She can't even make her own hair. She can't even put her own makeup on. So it's all about, what sense do you make out of any warning that your body keeps giving you? If your blood pressure is high, it's telling you that it's in trouble. Go check your blood pressure. I was having a chat with a gentleman from Nigeria not so long ago. He's saying to me, how come NHS don't give everybody a blood pressure machine to go home and check it? When I was giving a talk about high blood pressure. Then I asked her, if your uncle in Nigeria right now needs a blood pressure machine, what would you do? Because I would buy one and send him. I was like, go buy one and send it, mail it to yourself. As a matter of fact, buy it from Amazon, send it to you with your name on it, and give it to yourself as a present. Because it's so easy for you to focus on family members or extended families that you need to help, and you're not even helping yourself, right? I see people who need MRI, but if their uncle back home or their relative back home or wherever they are needs that MRI, they would send the money straight, but they wouldn't spend a little bit of money to actually look after themselves. So whenever your body gives you the warning, please, 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 you gotta have to listen to it. What separates most people from a large majority of people in our population is those people to whom their body has given a warning and they go, you know what, I want to do something about it. Right? So this is how I want you today to look at it in terms of your health issue. Right? Whenever somebody comes to me in clinic, let's say somebody comes in with high blood pressure, what would I do in that instance from the information that somebody is giving me? The first thing is I will calculate their risks. And I want everybody to take a screenshot of this screen, because I'm going to want you, after this is said and done, that you go home and calculate your own risk of every disease that you got, or any of them that runs in your family. Now, I'm going to use blood pressure as an example so that you understand what your risks are, because it will form the basis to which that you're going to be able to make changes in your life. And I have slides to tell you on how to. We got some examples as well. So work it out together, okay? So there are some things we call the modifiable risk factors and the non-modifiable risk factors. The non-modifiable risk factors are things that you cannot change. It's just exactly the way God handed it over to you. One is your age, your sex, your family history, your ethnicity, and your genetics. I call all of those things loaded gun. The reason I call them loaded gun is, imagine somebody comes to you and then give you a whole loaded gun, put it on the table. It's not going to fire itself. For you to get certain diseases, you need some of these modifiable risk factors that you're not paying attention to actually pull the trigger for you. So in terms of things like high blood pressure, for example, sex, men are more at risk of getting high blood pressure. It's just a given, particularly if you're over the age of 40. But when women start going through menopause or after menopause, the risk of blood pressure actually increases even higher. They match men in terms of the risk factor. If you don't know this, and you don't get your blood pressure checked out regularly, you get caught up with having high blood pressure. And one of the problems of high blood pressure, for example, is it's a silent killer. So it kills you. We know about high blood pressure that kill people in autopsy. So if you're lucky enough to get a warning or get some symptoms from it, then you're one of the lucky ones, right? But one of the ways to figure out what are my risks is to be aware that when you're getting older, if you're a woman after menopause, your risk of blood pressure is higher, particularly if you're Black, right? Your age, like I said, as you're getting older, your heart gets older with you. Your family history, does anybody in your family have any sort of disease? Within the Black community, it's getting better, because in the past, what used to happen, if you ask about 10 years ago, 20 years ago, if we ask somebody, particularly Africans, if you have any family history, nobody knows, because our parents, our grandparents, and perhaps doctors over there don't tell you what you have, and your people don't even know. Or if they know, because of cultural nuances, they won't be able to share some of the disease issues with you. I put ethnicity there. Ethnicity is, if you are Black, you are automatically at risk of getting a disease like high blood pressure. We don't know exactly why, but it's something to be aware of, right? And then of course your genetics. There are some people who are genetically predisposed to get some certain diseases. Now, you need about 6 of risk factors here to have diabetes or to have high blood pressure. And all of them, about 5 of them, belong to the non-modifiable risk factor, which means that you already dealt with a hand that if you are aware with all these non-modifiable risk factors that your risk of certain diseases, you will fight it like hell so that you don't even get close to developing blood pressure, developing certain diseases, developing Alzheimer's disease, because When you know this and work hard and have an aim and say to yourself, I'm not going to be a statistic. If you have blood pressure already, you go, I'm not going to be a statistic of people who got killed by high blood pressure because it's a reversible disease. It can be treated with lifestyle changes. And what are those triggers that pull the gun for you to develop certain diseases? Weight. We have the largest obesity rate of every race in the UK, in the US, perhaps in the world. The good thing about when it comes to things like smoking, what I find interesting is that even though in terms of the Black population in the UK, we're like about 3 to 4%, and the majority are Africans, but Caribbeans smoke way more, maybe about 3 times more than Africans do, which I find very interesting. Physical inactivity, a lot, particularly people from our African community as well, because the older they get, the more they feel as though they're not allowed to run. I asked a Nigerian auntie not so long ago, I was like, Auntie, how often do you go for a run? Because who? Run? Me. I was like, no, yes, exactly, you. She goes, oh, God forbid, do somebody see me running? It's not my portion, you know? So, excuse me. So the issue here is you have to be dedicated to do everything you can possibly do to make sure that disease is not your portion. That's the best way to think about it. Now, when it comes to my principle, I call it the 1% change, right? So let's say, I'm going to go to the next slide. I'm going to come back to this. Now, one of the things I always say to people to do, this is what I do in my coaching practice. We identify a problem, right? Let's say we did the risk calculator, and it shows that your risk of developing high blood pressure is high. So that's identifying the problem. Now, what we're going to do is now we're going to negotiate how we are going to do that. And in order for you to be able to do something about it, you have to be able to sit down and audit yourself. So how I do this in clinical practice, I'll get somebody to write down everything they do from the time they wake up to the time they go to bed and the time they wake up the following day. I want a 24-hour statistic of everything that you do, because it gives me opportunity to see where that we can fit in time for you to make some changes. Now, whenever we negotiate, we have a look, and I want you can do this by yourself as well. When we negotiate the percentage change that we want at any one time. So let's say, for example, you're a nurse. You're a nurse, which means you're going to be doing a lot of shifts. Sometimes you do morning, afternoon, or night shift. We have to figure out exactly what the pain points are. You know, when can we fit in exercise? When can we fit in for you to have something decent to eat? When can we fit in, you know, a talk about, you know, your stress level? When are we going to fit in, you know, time for you to actually have time alone, for you to focus and do certain things uninterrupted? Give yourself some time to breathe. If you start to do this from today and figure out in your mind and your spirit and your soul, how much change do you want and what's the time frame, right? I'm going to go back to the other slide. When I say, like, if you want to succeed whenever you're making any change, when you start a new habit that matters to you, it should be something that takes only 1% of your time at the beginning. And the reason is because as a lifestyle medicine doctor, I see a lot of people. January clinic is always packed. And it's half of the people who come to see me got like some beautiful printed out paper of their New Year resolution, what they want to achieve this year. February, 50% show up. March, 20%. By April, 0. And they come back the next year. By the time they come back next year, they've added on a bit more weight. There's one more disease that's crept up. You know, the list of their medications are growing. And then they come back with another New Year resolution. And that's how the New Year resolution goes round and round and round, multi-years. You know, you're still sitting at the point where you want to be years and years and years, and then you get frustrated. You become angry. Because now a lot of things that you could have corrected ages ago and have not caught up with you. And the primary reason people always fail is because they have unrealistic expectation. People want to run, I want to run a mile. I always say to them, I want you to run for 2 minutes today. Just take off, put the alarm on 2 minutes. Manage that. Next time you do 2.5. Next time you do 3. You have to gradually walk your way up to your tolerance threshold. But you need to identify your stop loss. I was learning how to do trading a few years ago. And one of the things that I learned there is when you put your trade, let's say you want to buy Microsoft. Today, Microsoft is going at 150 pounds, right? But you want to sell. Whenever you want to sell, you need to make sure that if Microsoft drops to 100 pounds or $100 today, that you have put a contingency plan in place so that you don't lose your whole money. So because you bought it for 150, you may put your stop loss as 145, which means you can only lose just a tiny bit without losing everything. Whenever that you are trying to make a life change about anything, make sure you put a stop loss. So if your aim is to lose weight, you can say to yourself, no matter what happens, my stop loss is I have to eat 1 apple a day. If I can't fit in any greenies, I want to have like a berry, a handful of berry. So even if you're sick, you know that that's the lowest that I can go without falling off the track. Now, one of the things that you're going to encounter is your brain. Your brain is one of the most interesting organ in the body. 1 minute, your brain wants to look after you. And then the second minute, your brain affects the way that you plan to do things, let's say, all right? So the commonest reason why people struggle with weight loss is because our body is designed to be protective. It's supposed to be there for you when the going is tough. As soon as you lose weight, your body thinks that you're going through some malnutrition issues. Your brain will start forcing you to eat more. So you start encouraging, you start getting the smell of everything that you used to like before. You drive past McDonald's, you look like you want to make a pit stop. That's what your brain is designed to do. One of the ways that I teach my clients is I say to them, you look at the mirror and you talk to your brain because it's yours, you own it. Yeah, it's supposed to be working for you, not the other way around. So I would say to them, talk to your brain and go, you know what? I am doing this thing intentionally, and I want you to support me all the way through. The more you work on your brain to push hard, push past a lot of things, the more your brain will be there to support you all the way. If you fail, which you will, you need to remember that failure is not because you're weak. Failure is because maybe we need to tweak a little bit of our approach. if doing 1% is going to be hard and then you fail, I want you to go to 0.25 and see if you can work your way up. If 0.25 is hard, go to 0.15. Provided you're doing something each day that is better than yesterday, for me, that's a win. Now, this is a goals diagram that I typically use in clinical practice. So when somebody comes in, we have like yearly goals, daily goals, weekly goals, monthly goals, so that we reach the optimum of the goals that we want. And I have an example of a patient we are going to walk through, okay? So this gentleman, his name is Deval. So let's say Deval is 49 years old, right? So he came to see you in clinic. His HbA1c is 47. Now, HbA1c is a measure, it's one of the ways to diagnose diabetes in the UK. We diagnose diabetes from 48 and above in terms of HbA1c. But you have prediabetes if you score between 42 and 47. So you can see that he is 47 and diabetes diagnosis is at 48. In my book, in my clinic, this is diabetes, even though it's not official, because there's no difference between when you're 47 and 48. You already got way too much sugar. The sugar in your body is not spilling out. So there's no utility in, and one of the things that doctors get wrong, in most cases, is somebody will come with this blood test and they go, wow, the good news is you don't have diabetes. I was like, no. You have diabetes in my book, but not official. And we checked the blood pressure to 155 over 94. BMI is high. Married, teacher, then works as a London transport manager. Now, so this is some of the ways that I normally run in my clinic. So I always like to dig. I ask a lot of questions. So I'm trying to establish, okay, what is his inner core? How does this man cope on a day-to-day basis? He sleeps. I want to understand about his sleep. I want to know whether he's meeting the 7 to 9 hours that we know that is for optimal health. I need to make sure that he's actually exercising at all. I need to make sure he's eating the right thing, that he's not smoking, that his relationship is good, and he's not stressed. So now, when it comes to his case, you can see here that so many of the things in his pillars of health are not optimal. So if he had told me this, I would have expected his results. And his result is reflective of his lifestyle, right? The reason why Deval sleeps 5 hours every night is because Deval had to wake up every night to pee at least about 3 or 4 times because the body has way too much sugar. And also, he can't sleep because when you wake up, go wee, come back, fall asleep, you have to wake up again and all of this stuff, right? Now, when we talked about the relationship part, so no action in 7 weeks was when he was basically indicating that he is not having any sort of relationship with his partner, things like that. So this is how I managed to help Deval in clinic, right? So we developed his main issue here is if we are able to improve his sugar level, then we will be able to solve every single problem that he is encountering at the moment. Number one is when we worked his sugar to go from 47, and we brought it back to 38, he was able to sleep up to 7 hours. He was sleeping better. His relationship is better. His behavior has changed, because the consequences of not doing anything in those instances is risk of erectile dysfunction, risk of amputation, risk of blindness, risk of certain diseases in the first instance. So if you have prediabetes, and if you haven't had any blood tests recently, I want you to see your GP and get your sugars done, because this is one of the commonest reasons why people in our community die as a consequence of diabetes. So now I'm gonna skip over this part, because I know there's going to be some questions some people may have in terms of some of the challenges that they have encountered in their personal lives, and they want to ask questions about how they may be able to, what strategies that they may be able to employ and to help them moving forward, right? So when I gave the talk at the national conference last time, and I told them that Black people are hungry for non-pharmacological approaches, which is the way that we exercise, which is the way that we look at our lives, what is available for us, for example, all of this good stuff, right? So it's very, very important, and I'm quite happy to answer questions. If people want to contact me afterwards, I'm quite happy with it. And I know that we're running a bit later in time. I got some nudges that we're running a bit late. So this is Men's Wellness Month. And one of the things I want to do is I want to help any man here who wants to have, I'm going to give a 15 minutes free consultation for anybody who wants to talk to me about something that they're going through, so that way I'll be able to help shape your own personal issues, and then be able to tell you, these are things that I think that you can do and do better. So I will leave my email address, so that way you'll be able to contact my secretary or my PA. They'll be able to reflect to me, and I will contact you, and we schedule a 15 minutes free consultation about lifestyle and things you may want to achieve. Okay. So like I was mentioning earlier, but I think 2 weeks ago, we were very lucky to open a nationwide online GP that anybody in the country can actually have access to. And that's one of the reasons why I was running a bit late this morning, because we are becoming very, very busy. So this is my new clinic. It's called Passport Health UK. This is a GP clinic. We also have a lifestyle consultation. We also have menopause clinic in there as well. So if anybody's interested in seeing us, that would be great. We are, for Men's Health Awareness Month as well, we are going to be doing a specific 20% off for consultation for people who are actually watching us here. So that's for you guys, for at least being kind enough to wait around. I know most people usually this thing finishes about 12 o'clock, but it is what it is. But I was so keen, I was going to cancel it because the clinic was going so fast. But this is a very important meeting for me to be here and talk to people. And there's so many other topics that we're going to be bringing out, perhaps in our podcast. I will send it to Khan. They will be able to send it across to you guys. Again, it's free of charge. Okay, I didn't realize they put it up here. So take a screenshot of this if you want. We run for all the blood tests in the planet that you can think of. We're linked with the best hospitals and top hospitals in the UK. So this is my information. So if you want the 15 minutes free coaching, you go to the coaching at the Lifestyle Wellness Clinic. That's my gift for you today for being here. And thank you so much for listening. I know this is not like the typical, this is headache, this is what you do, but I think we've done quite a lot of that like this year. I wanted to try something slightly different, but in the future, I would tell Khan, if there's any specific topic that you want me to address, then I'll be able to do a bit more justice on it and put it in a manner that you guys will be able to appreciate perhaps better. So thank you so much for your audience, and thank you for listening.
Thank you so much, Dr. Amobi. And as you say, we completely are really grateful for the time that you've given us today, and the fact that you've come from a clinic directly here. So we really, really appreciate it. And I'm really aware, because we've run over, and we did have quite a few questions coming in, which I just want to thank everyone as well, because when you have such a great talk as well, you can always see all the questions coming through. But and I'm two things. Dr. Amobi has given such a fantastic offer for men. So we're calling out for men to take up that offer. He's also provided a number of contacts there to, if you'd like to contact him separately. Also, we will be, the slides will be available, so you can contact colleagues. I think colleagues have put the email in the chat for you to contact as well. So you have those approaches there. But Dr. Amobi, I feel like we should just, in 30 seconds, one of the questions that's come up, and I think it's something that we talk about menopause a lot. We're talking about it more, which is fantastic. But there's I'm just going to pick out one of the questions that are here, so that just for you to answer. I have to say, in 30 seconds, that would be great. But just to give a bit of a snapshot answer, and then we'll close off. But thank you to you. You were fantastic. Thank you to all our listeners for persevering with us. And it's, as ever, we're grateful for your time and look forward to seeing you next week. But the question is, how do I adapt my mindset and prepare for those pretty awful menopause symptoms? What is your advice? So just a kind of 30-second review.
Yeah. No, that's a very good question. And menopause is one of my areas of special interest. I give a lot of talks on it, even here at Cannes. What I would say is it depends on the symptom that is bothering you the most. There are like well over 34 symptoms. I think we'll stop counting now, because menopause can virtually affect anything, any of your body system. Not affecting it, but the loss of estrogen that you're not producing can provide some of the symptoms that will be bothersome. So number one question I'll ask is, what is your top 3 pain points? And then that's how we start changing things, because it's going to be quite hard for you to change every single symptom that you encounter in menopause. So I would say, let's say, for example, it's brain fog. One of the first things I do is, or any of the symptoms, is I rule out the biological causes first. So brain fog, I would do something like check your testosterone, or somebody who got low libido, I'll be checking their testosterone, I'll be checking all the hormonal profiles too, so that I can rule out all the symptoms. Then when we clear that out, then the next thing I will focus on doing is then creating a mindset of how to handle, because the thing though is you are going to go through those symptoms. Question is, how are we going to make it livable? But the good news is it's a temporary thing that will go away at some point. But the most important thing is to educate on how to navigate that terrain. So actually, if it's possible for you to perhaps contact me directly. I will give you a free 15 minutes consultation as well, so that we'll be able to talk about what are your pain points and then how I'll be able to help you. Because I only got 30 seconds, so I just don't want to skip over what's important. But I'm quite happy to offer a free 15 minutes consultation to you so we can have a chat.
Thank you so, so much. I just want to say that I've learned so much, and lots of things will be applied to my life as well. So, but I just want to thank you for your time, for your energy and information, and also to everyone that's been listening. And we will be with you again next week. So thank you all. Take care, everyone.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.